With us today is plastic surgeon and MD-TV guest medical expert, Dr. Barry Weintraub. Dr. Weintraub is a board-certified diplomat of the American Board of Plastic Surgery and a fellow of the American College of Surgeons. He is a member of the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery. Dr. Weintraub lectures nationally and is viewed by American media as an invaluable resource on the topic of plastic surgery. Doctor, welcome to the program.
Nice to meet you.
What would you say are some of the most important issues that someone would have to take into consideration if they were thinking about having a rhinoplasty performed?
The three issues that patients and doctors really need to consider revolve, in the first place, around the physician, wherein the physician should first listen, second listen, and third listen, because it's a time for a rather nervous person to air their thoughts and feelings about why they've come to that physician on that given day. On a given consultation afternoon, a patient will be greeted just like you just greeted me and be asked to sit down on a gurney and be given a mirror and ask what, when they look in the mirror, seems to bother them about their nose, for example. They'll take their opposite index finger and while looking in the mirror, point to different things, like a bump in the center of the nose. Sometimes there's a downturned nasal tip. Sometimes there's a broader nasal tip. And it's a good time for me to allow that person to speak. And in between their sentences, I'll manage a way to say, it's really wonderful that you're able to explain this to me today because it's a learning day and we're not having surgery tomorrow. And there's always a wonderful sigh of relief because a lot of the fear seems to go away the more the patient speaks about what he or she is sharing with me.
Well, Linda Marr is a patient care coordinator with Dr. Weintraub as well as a patient herself. She joins us to offer her perspective on cosmetic surgery from both sides. Welcome to the program, Linda.
Thank you.
So describe your role as patient care coordinator.
Well, my primary role is to be with the patient from their initial consultation straight through their recovery period. I'm there to further educate them by providing them with literature not only on Dr. Weintraub and his credentials, but also on the procedures that they're contemplating. I'm there to guide them with respect to taking time off from work or from their normal daily activities, and I'm there to instruct them because with any procedure there are preparations that need to be made. And I'm also there to listen because elective cosmetic surgery is such a big and personal decision that oftentimes patients don't have a friend or a colleague or a family member that they can share it with. So listening is really important, and I'm there to encourage them because it's a wonderful decision to go forward with. And lastly, I'm there to support them, again, from the beginning straight through to the end, so they know that they're getting the best possible care that can be provided to them.
How do you think that being a patient yourself has helped you to relate to the other patients better?
Oh, it absolutely helps. I have to tell you, the first question that I am asked by almost every patient I sit down with is, have you had anything done yourself? And when I say yes, there's such a sense of comfort because I too chose Dr. Weintraub to do my plastic surgery. And I too had a little bit of nervousness about it. I had questions, I had concerns. So anything that I discuss or share with them is coming from my own personal experience and not because I was instructed to say so.
And Dr. Weintraub, can you explain to us exactly what you did for Linda?
Sure. As you can see, Linda is a very, very beautiful woman, and much of that is God-given. I have nothing to do with it, but I'll try to point out the few parts that I was able to help with. When she came in originally, there was a bump on the center of the nose and a downturned nasal tip, and that made her look a little sad, and she was minus that neat straight line that she now has between the nasal bones and the nasal cartilage, and this gives her a more natural profile with the highest point at her nasal tip. In liposuctioning her neck, it removed the obtuseness of her neck in the lower parts and sharpened her jawline. I like to do my neck liposuctions through 3 separate apertures, one under the chin, and then I like to add one behind each earlobe so that the liposuction cannula crisscrosses itself. And in crisscrossing itself, you can really, really see the sharpness and detail she had. Later on in life, she thought of having a blepharoplasty as well, which was very minimal and was done also under anesthesia.
Well, Linda, we appreciate you sharing your experience with us today.
Thank you. My pleasure.
Since the introduction of breast augmentation to the American public in the 1950s, nearly 3 million women have undergone the procedure. There are 3 main groups of women who seek out breast augmentation. The majority of women are motivated by the desire to attain a more proportionate figure. Oftentimes, the breasts have never fully formed. Similarly, other women take advantage of breast augmentation to balance out breasts that have developed unevenly. The third group of women may have been satisfied with their breast size at one time, but their breasts have shrunk or sag as a result of nursing children, aging, or weight shifts.
Well, I was approaching 50 years old, and I wanted to look younger and fresher, not different. So I decided to do my homework and shop around for an appropriate plastic surgeon.
I'm a celebrity makeup artist, and I've worked on a lot of high-profile celebrities, and I decided to have laser resurfacing, breast aug, and liposuction.
I've been a writer and producer on the series Baywatch for almost the past 10 years, and made a lot of friends with the cast and crew, which a lot of it remained the same for those entire 10 years. And a lot of the people on Baywatch or any television show, that's their livelihood. They get paid to look great. I don't get paid to look great. I get paid to write well. I just like to look great.
But the most important thing is to look rested. Not to look like you've had plastic surgery done, but to look like you've been on a vacation. And that's what Dr. Weintraub did for me. The qualities an ideal doctor would have is to listen to what a patient wants. That is the #1 thing, is to listen to the keywords of what's going to make a patient happy. Suggest things, but not push them.
I feel very proud of myself that I went after something that I wanted, regardless of what anyone else thought of me.
The way I feel every morning is I look in the mirror, I have a full-length mirror, and I look to be sure I look good and still have the thin thighs. And I look at this and I can't believe it's me. And I say, thank God I found a great doctor like I did.
Dr. Trust must be such an important factor in the doctor-patient relationship. What is the responsibility of the doctor to help build a solid foundation of trust?
Trust is the most important part of the doctor-patient relationship. I mean, imagine having a surgeon operate on you that you don't trust. I mean, the two are just on opposite ends of the spectrum. And trust has to be built. And the building of trust comes with separate in-office consultations along with the accumulation of knowledge by that patient about what the surgeon can and cannot do with his or her 10 fingers. In my office, it's very important that we review the patient's concerns, we point out each problem that needs to be solved, and then explain what is a realistic expectation, both in terms of time off personally and professionally in the postoperative period. But you can't begin the process unless you have trust to start with.
Okay, thank you, Dr. Weintraub.